Welcome to Nursing Manthra. I hope all you are keeping well. Did you watch our last video regarding gastrointestinal system? If you didn't watch, please see the last video regarding gastrointestinal system disorder, that is GERD. Why I am telling this means the continuation of GERD, I am going to take the next topic related to that. If you know something regarding GERD, then it will be easy for you to understand our new topic. So before going through the video, if you are a newcomer to this channel, please subscribe the YouTube channel Nursing Manthra and enable the bell icon to get the updated notifications of my videos. Our all classes, it is based on the PROMETRIC exams. Those who are writing the PROMETRIC exams for DHA, HAAD, MOH, Qatar PROMETRIC, Saudi PROMETRIC, Oman PROMETRIC, so it will be more useful for you to understand the exact topics which will be coming for the exams. So like when we are studying the nursing studies, like medical surgical nursing, we are learning so many disease conditions. But for your PROMETRIC exams, all these topics will not come for your exam. So hereby I am teaching you what are the important topics which will come for the PROMETRIC exams. So now we will see today's topic, that is hiatal hernia. Another name for this is esophageal hernia or the diaphragmatic hernia. So what is hernia? Hernia is a protrusion of the small part of intestine or the stomach or in the any internal organs through a weakened muscles. So here hiatal hernia, so before going through that, we want to understand what is hiatus. What is the hiatus junction? So like in the diaphragm, there is an opening that will be leads to the like esophagus, it will leads to the stomach. Okay, there is a connection pipe will be there. So that opening, that area, there will be weakened muscles will be there. So the opening will be wide opening. So what will happen if any pressure in the stomach, intra-abdominal pressure, it will leads to the stomach content to go up towards the esophagus through the diaphragm, that hiatus muscle weakness, that hole. So here the herniation of gastric mucosa into the esophagus, that is the definition for hiatal hernia or diaphragmatic hernia or esophageal hernia. So there are mainly two types of hiatal hernia. So first one is sliding hiatal hernia. So sliding in the sense, so this is the stomach part, okay? So this is the stomach part only, the upper fundus part of the stomach. This is the opening. So here with this opening, it is a wide opening because this muscle is weakened muscle, okay, weakened hiatus muscles. So through this, the stomach part, sometimes even intestinal part, a complete stomach or intestinal part also coming upwards, that is a life-threatening complication. So with this, what will happen means the upper part of the stomach will moves through the esophagus and it will come down again going up like it is sliding. Okay, when we are having the food, it will come down. When anything we are lifting up or like a severe cough, all those things, or more in the pregnancy or like more obesity, when there is an increased intra-abdominal pressure, the stomach part, it will comes up. So it is a sliding going upwards and downwards because of the weakened muscles in the hiatus. I hope you understood regarding the sliding hiatal hernia. So another type is there, that is paraesophageal rolling hiatal hernia. Paraesophageal or rolling hiatal hernia. Sliding is there, rolling is there. So here what will be happening means the herniated part will be located in this side. Herniated portion of the stomach will be like this, enlarging here. So it will not slide, always it will not be a sliding one. It will roll in this side, okay, it will not come down. Oh, so this is the types, two types. One is sliding hiatal hernia, another one is paraesophageal or rolling hiatal hernia. I hope you understood the types of hiatal hernia. Now, what are the causes for this hiatal hernia? So there are more problems which will lead to the hiatal hernia, that is pregnancy, like the issues which will cause the increased intra-abdominal pressure, maybe pregnancy or more obesity persons, okay, obese persons there is a chance, or any tumors in the stomach. All this will cause the increased intra-abdominal pressure. That is one main reason for this hiatal hernia. And if there is an ascites in liver cirrhosis and all, you can see there will be fluid collection will be there in the stomach, that is ascites, tumor, obesity, or the congenital weakness of the diaphragm. Okay, these are the main causes for this hiatal hernia. So what will be the clinical features? You can see that the abdominal shape, it will be scaphoid abdomen. Okay, because the upper part of the stomach, it will move through the esophagus area, through the diaphragm. So what will happen, the stomach, it will be scaphoid position, it will be there. So another important problem is like same like GERD symptoms you can see here, like heartburn will be there, palpitations will be there, burning sensation will be there, irritations will be there, and like feeling of fullness in the stomach, and there is a constipation. If there is an obstruction, there will be constipations will be there, and bloating sensation will be there. These are the main clinical features of this hiatal hernia. So how we can diagnose this hiatal hernia? That is very important. Patient will be saying too many complications, like a patient will be complaining chest pain, then we will be thinking that oh, it is related to the chest, okay, chest pain, cardiac issues. So we are doing all the ECG, cardiac enzymes, everything we are doing. So it will get confused. What is the exact reason for this? So proper history taking is very important. And the diagnostic measures, usually after a history collection and physical examination, we are doing the X-ray. Chest X-ray we are doing, in that we can identify, or barium swallow studies we can do, endoscopy we can do it, CT scan, CT thorax and all we can do in this case. So it will be easily identifiable through these diagnostic measures. So what is the management? So we understood that it is a hiatal hernia. So now we are going through the management of this condition. Management, mainly it is Nissen's fundoplication, as we have seen in the GERD disease. And the other nursing management, same like GERD, what we are giving the management, like avoid spicy foods, okay, frequent and small feeds, avoid carbonated beverages, spicy foods, like a coffee, tea, milk, everything we have to avoid, and try to avoid sleeping soon after having the food, okay, at least 2 hours we want to have to be walking or in the sitting position, like that. Same like GERD, what all of the management which I have told to you, same thing also we can apply here also in this case of hiatal hernia. For this hiatal hernia, there are complications are there. So main complication for hiatal hernia is incarcerated hernia. Incarcerated hernia means this hernia part, it will not be reducible, okay, it will not be we cannot be cure, it will not be curable one. So it will leads to the obstruction and strangulations will be there. So most of the cases with the Nissen's fundoplication, what I discussed in GERD, it is a surgery, we can reduce the hernia and we can the stomach part, it will come back to the normal position. And we want to be take more careful, then avoid the lifting of the heavy weights, avoid sneezing, coughing, giving more pressure to the stomach, then reduce your obesity, and even pregnancy. Anyway, we cannot do anything in the pregnancy, but some of the problems we can reduce. After the pregnancy it will be all right. Congenital issues for this diaphragmatic muscles means we want to do the surgical management itself. So medications same like GARD, proton inhibitors, heteroreceptors, according to the symptoms, the symptomatic management we can provide as a medical management. So this is regarding the hiatal hernia or diaphragmatic hernia or esophageal hernia. Please subscribe Nursing Manthra YouTube channel to get the updated videos related to the PROMETRIC exam important topics. So if you have any nursing friends who is going to write the PROMETRIC exams in all the authorities, all the Gulf authorities, DHA, HAAD, like Qatar PROMETRIC, Oman PROMETRIC, Saudi PROMETRIC, or MOH UAE, anywhere, all the PROMETRIC exams, these topics will be helpful for you. And I mentioned clearly the important topics from each system. I am giving here the coaching. So if you have any friends, please share this link to them, so it will be more useful for them. And those candidates who cannot go for a special coaching, so for them also it will be helpful. I hope all you understood our topic. So please subscribe the channel and enable the bell icon to get the notification of my latest videos.